The last person to propose a natural cure against cancer is Tullio Simoncini, an Italian oncologist who finds himself in the middle of a storm after having declared that the origin of cancer is not genetic, but it is due to the aggression of a fungus called Candida albicans. Based on this hypothesis, Dr. Simoncini treats cancer with sodium bicarbonate, which is one of the strongest enemies of fungi in nature. How does a fungus get in the body? Where do you think this all starts from years of research?
There is an endemic, a big epidemic pollution because the fungus is undervalued. But it is undervalued because it is not understood.
From the very beginning of his studies, Dr. Simoncini felt the need to reconsider the cancer paradigm from scratch and began looking for a different origin of the disease. What puzzled him the most was the fact that all tumors behave in the same way, even though they appear completely different from one another. Then he started looking for a common denominator and eventually found one. Most cancers appear white. These tumor specimens show the devastating impact the disease can have on the body. This is a liver riddled with cancer. The white bubbles are all tumors.
If you enter the body and you reach an organ affected by the cancer, you can see that the lumps are always white. Sometimes it is covered with blood or with the defense reaction, but in every post-mortem examination, scientists find the white lumps, the white masses, that is fungi. This is the pleura. We entered with the camera and look, the pleura should be red, but you can see all the lumps, all the cancer that is white. This is the heart beating. This is a bronchial cancer. Look, we went into the bronchia. Look, they are white. And then in the colon cancer, this is red because there is a little bit blood. I washed it up. Now, look, it is always white.
White like Candida. Candida albicans in Latin means glowing white. It should be clarified that the presence of fungi in tumors is nothing new in the medical world.
All the scientists find in the oncologic world the cancer patients, when they die, they are all invaded by the fungi, but nobody wonders that it is the only microorganism present in cancer patients.
Official oncology, however, believes that their presence in tumors is due to their opportunistic nature, which brings them to build colonies wherever they find a suitable environment. This belief, though, seems contradicted by a careful observation of the animal world.
Spores from a parasitic fungus called Cordyceps have infiltrated this ant's body and mind. As soon as she is discovered by the workers, the ant is taken away and dumped far away from the colony. It seems extreme, but this is the reason why. After a while, the fruiting body of the Cordyceps erupts from the ant's head. It can take 3 weeks to grow, and when finished, the deadly spores will burst from its tip. Then, any ant in the vicinity will be in serious risk of death. The fungus is so virulent, it can wipe out whole colonies of ants. And it's not just ants that fall victims to this killer.
In this case, it was the fungus that caused the ant's death, not the death of the ant to invite the presence of the fungus. What normally appears to be a simple opportunist is in fact a full-fledged assassin.
Allora viene il dubbio, non sarà che viene prima debilita l'organismo e poi nel momento in cui la si vede è il momento della massima invasione? Chi ci dice che sia solamente un post hoc? Il fatto che ci sia è un dato di fatto, il fatto che sia un post hoc è un'interpretazione.
Not all infections are bacteria. There are also the fungi. Viruses, smaller. Fungi, bigger. And fungi are the connecting point from the microorganism and the animals. So they can enter in a body like microorganisms, and they can aggregate once they are inside, and they can build a big mass that has the power of an animal.
Candida is a very familiar fungus, known especially to women, who sometimes experience an infection in their sexual organs.
The vagina is a muscular canal that leads from the outside of the body to the uterus. The warmth and moisture of this canal create a perfect environment for microorganisms to breed. For example, bacteria called lactobacilli, which are naturally present in the vagina, coexist with a yeast fungus called Candida albicans. Normally, the lactobacilli create an acidic environment that keeps the natural yeast population in balance. However, when conditions within the vagina change that either decrease the numbers of lactobacilli or decrease the acidity, these yeast fungi begin to multiply.
Normally, the immune system keeps the fungi under control and doesn't allow them to establish colonies in your body. This white cell spots a fungus in the bloodstream, attacks it, and destroys it. If the system's defenses instead get lower than usual, the Candida can manage to aggregate into small colonies practically everywhere in the body.
Nel momento in cui un fungo entra dentro il tessuto, la parte interna dell'organismo, si chiama la candidosi intima, evoca una reazione di tipo immunitario cellulare che porta alla formazione del tumore. Il tumore, secondo me, sarebbe quindi l'insieme dell'invasione fungina più la reazione cellulare che l'organismo mette in campo.
Far from being a wild, uncontrolled cellular replication, according to Simoncini, the growth of a tumor is a lucid and desperate reaction from the organism in an extreme attempt to reject the intruder. By the same token, Dr. Simoncini believes that metastases are not cancerous cells that leave the primary tumor to go start a new one somewhere else, but small groups of fungi belonging to the primary tumor that fall into the bloodstream during biopsies or during a regular surgical operation. These runaway fungi settle in a new environment and prepare to take advantage of a weakened organism to establish their new colony. Once this propagation has started, it becomes necessary to restore the immune system to its maximum potency as soon as possible. If the patient is given chemotherapy instead, this only accelerates the destruction of his natural defenses, as the drug kills indiscriminately cancerous and healthy cells. While possibly prolonging the survival by a few months, chemotherapy makes it impossible for the organism to recover its defense capabilities, making it bound to succumb, sooner or later, to the multiplying fungal attacks. In order to test his theory, Dr. Simoncini began treating cancer with sodium bicarbonate.
Sodium bicarbonate is the strongest substance against fungi. They cannot adapt to a salt because it is not a complex substance. That's why the antifungal today's antifungal drugs are ineffective, because the fungi can adapt themselves in 3-4 days. For a fungus, you give an antifungal drug, you can kill the first layer, but the second layer they get used and they eat drugs, chemotherapy, everything.
Gennaro San Germano is the first patient ever cured by Dr. Simoncini with sodium bicarbonate. In 1983 he was diagnosed with lung cancer and was given a life expectancy of 6-7 months at best. In 2006, 23 years later, he gave this interview.
Buonasera. Buonasera, io mi chiamo Massimo. Mi sembra di parlare con una persona molto fortunata, mi sembra di capire, giusto?
Sì, molto fortunato, veramente.
Perché i pesi...
Molto fortunato, ma grazie a Dio al dottore Simoncini. Sono incontrato con fortuna perché mi aveva detto che mi doveva fare un atto di ricovero. Perché la macchia si stava allargando quando sono andato alla visita. E ha detto vieni da me, sono andato con la cura che mi ha dato lui, con grazia di Dio.
E ci ha messo, mi diceva la moglie, ci ha messo 8-9 mesi a guarire?
Sì, oltre 9 mesi.
Però se n'è andato via tutto il tumore?
Sì, per grazie a Dio sì, che hanno ritrovato, che è andato via. Non credere, però a me è andato bene.
Già è lì, infatti.
Ecco, perché mi hanno detto che c'aveva 6-7 mesi di vita addirittura.
Lei non ha fatto nessun'altra cura insieme a Simoncini, cioè lei è sicuro che l'ha guarita questa cosa qua?
Sì.
Non ha fatto nient'altro?
La cura di Simoncini altri non sono andati. Adesso solo che più qualche raffreddore, la febbre, mi hanno un altro medico.
Vabbè, chiaro, normale.
Allora, comunque la cura là non l'ha fatta solo lui.
Non ha fatto nient'altro insieme?
No.
Ho capito.
After a few successful treatments, Dr. Simoncini presented his documentation to the Italian Department of Health, hoping that his theory was put to test under proper scientific protocols. Not only were his findings completely ignored, but Dr. Simoncini ended up being disbarred from the Italian medical order for having prescribed cures that had not been approved by the authorities. This is rather unfortunate, as even the ancient Hindu books of medicine prescribe the use of sodium bicarbonate against cancer. Alkali of strong potency should be used in diseases arising from anula, schlesma, maida, cancerous growths, and such others which are very difficult to cure. This book is over 1,000 years old. As soon as the news of his treatment started to circulate, Dr. Simoncini became the target of a major smear campaign orchestrated through the Italian media, in which he was treated as a charlatan and a swindler.
Amici di Striscia, oggi vi parleremo di un personaggio che dice di curare i tumori con il bicarbonato. Seguiteci. Buonasera, Jimmy Ghione, Striscia la notizia. Come va?
Niente, lascio.
Senta, ma com'è questa storia del bicarbonato? Ci può raccontare com'è che si curano i tumori con il bicarbonato? E ci può raccontare un po' com'è questa storia? Se basta il bicarbonato per curare i tumori.
Aspetti che vedi scendo.
No, aspetti che
riscendo.
Ma perché fa così?
Dr. Simoncini was also repeatedly sued for wrongful death, and in one case sentenced to 3 years in prison for having allegedly caused the death of patients who had undergone his treatment. The media seized greedily on the trials, delivering the final blow to Dr. Simoncini's credibility.
Professor Francesco Cognetti, direttore scientifico dell'Istituto Nazionale dei Tumori di Regina Elena di Roma, uno dei più importanti oncologi italiani. No, perché quando parliamo di medicina e anche di cure innovative bisogna stare attenti. Dice quest'uomo, sto Simoncini, è un fungo, il tumore è un fungo e si cura col bicarbonato di sodio. L'impressione immediata di un grande medico.
Beh, una tesi bizzarra, voler essere ottimisti, e direi che è pazzesco, non c'è nessuna dimostrazione che ci siano rapporti tra infezioni fungine e neoplasie, né tantomeno che i funghi siano l'unica causa di cancro, come sostenuto dal dottor Simoncini.
Possiamo dire con assoluta certezza che il bicarbonato di sodio al tumore purtroppo non gli fa nulla, se no sarebbe stato molto semplice
assolutamente
affrontarlo.
nulla, ma può essere, devo dire, anche pericoloso, perché se somministrato a dosi importanti può determinare squilibri metabolici importantissimi che possono compromettere la funzione renale, la funzione respiratoria, la funzione cardiaca, cerebrale, e quindi è un farmaco che, se somministrato a dosi importanti, può determinare anche la morte.
The paradox is that Tullio Simoncini is not an alternative doctor, nor is he against the system at all, but he is possibly the most allopathic and orthodox of them all.
Io penso che la strada per far fuori il fungo dentro, fuori e anche il tumore sia quella di concepire degli antifungini a cascata sequenziale. Il concetto in chemioterapia esiste, le terapie sequenziali fatte a cicli, eccetera, eccetera, perché bisognerebbe scogitare degli antifungini che sono efficaci in un primo momento, come il fungo varia, cambiare l'antifungino in funzione della variazione del fungo e così stargli dietro secondo le variazioni. Però dovrebbero venire in campo le case farmaceutiche in questo momento, che adesso non capiscono questo grosso affare che c'è sotto. Loro vedono la multinazionale che fa, vede il pericolo dell'azzeramento dei chemioterapi, eccetera, e fa guerra, fa terreno bruciato a tutti. Chi dice qualsiasi cosa gli taglia il collo.
In the meantime, he has perfected special techniques that allow him to deliver the sodium bicarbonate next to the tumor in order to obtain the maximum effectiveness with the minimum amount of sodium bicarbonate.
Sodium bicarbonate is effective if you can put in contact the sodium bicarbonate with the cancer. So, if you want to reach the prostate cancer, you have to locate before a catheter in the pudenda artery that reaches the prostate. Then you can administer through a port cat connected to the catheter the sodium bicarbonate directly to the prostate and kill fungi, because the concentration of the salt is very high, because you used the artery that is directly feeding the organ. Instead, for the cavities, pleura, peritoneum, you have to locate a transperitoneal or a pleural catheter.
Although considered only anecdotal material and not scientific evidence, there are now dozens of fully documented testimonies which appear on Dr. Simoncini's website that seem to support the validity of his innovative approach to cancer. This therapy you're talking about, sodium bicarbonate delivered directly into the tumor site, I wonder where the harm is. Seems like a very harmless therapy. It isn't a potent, dangerous medicine.
No, it's not dangerous, because there is a remote possibility of infection, but there is the life on the other hand. And then there are some type of cancer. Breast cancer doesn't need of the catheter. Bladder cancer, brain cancer, breast and bladder cancer with the sodium bicarbonate can heal in 99% without surgery, without chemotherapy, without radiotherapy, and let the organs there.
Dr. Simoncini believes that also skin cancers are caused by a fungus and treats them with regular iodine tincture. In some cases, patients have reported even the nastiest melanomas to fall off within weeks, like simple scabs.
And the cancer is gone?
Totally gone. For the first time, I feel like I got my life back again.
Not every cancer, however, can be treated with the same effectiveness. Bone cancers, for example, receive hardly any blood at all and are very difficult to reach with the proper amount of sodium bicarbonate. Different techniques, in some cases, can be applied. The last testimony is from someone who found himself on both sides of the fence at the same time. A doctor who got cancer.
Io mi chiamo Carmelo Lombardo.
Di mestiere?
Mestiere faccio il medico.
After the removal of a primary tumor in the bowel, Dr. Lombardo learned he had some metastasis in his liver. Just before undergoing the liver surgery, he learned that he had also developed a metastasis in each of his lungs.
Ormai avevo detto va bene. Quando sono stato operato ai miei cari non l'ho detto, però pensavo di avere se no 1 anno e mezzo, 2 anni, forse.
After returning home, Dr. Lombardo found out about Dr. Simoncini's therapy and chose to use the ports that had been prepared for the chemo to introduce the bicarbonate solution instead.
Ah, quindi lei aveva il port per la chemio e invece l'ha usato per infilare il bicarbonato?
Sì, il bicarbonato, sì.
E il porto dove ce l'aveva esattamente?
Il porto ce l'ho all'altezza della seconda costola, precisamente hanno incanalato la carotide interna e raggiunge la cava superiore.
After a few cycles of sodium bicarbonate, a CAT scan revealed both tumors had disappeared from his lungs.
Con esame fatto con mezzo di contrasto e senza contrasto non si apprezzano lesioni né di tipo primitivo né di tipo secondario.
Lei ha un messaggio da dare ai suoi colleghi medici? Di qualcosa?
Ai colleghi medici sicuramente. Io dico una frase che dico sempre: la verità a volte è davanti alla punta del nostro naso, ma è talmente vicina che non riusciamo a metterla a fuoco, quindi a vederla. Quindi cerchiamo, e poi un'altra cosa, la verità non esiste una verità. La verità non è qualcosa che tu puoi pensare di possedere. La verità è ricerca. La verità la trovi soltanto se ampi i tuoi orizzonti, se allarghi il tuo modo di vedere.